Today we are going to learn about nose and nasal septum. In this session, we are going to learn about the introduction, parts, external nose, nasal cavity, nasal septum, and clinical anatomy of nose and nasal septum. The nose is the first organ of the upper respiratory tract in the respiratory system. Its main respiratory function is the supply and conditioning by warming, moistening, and filtering of the particles of the inhaled air. The nasal hairs in the nostrils have large particles preventing their entry into the lungs. The nose performs two functions. It is the respiratory passage, it also the organ of smell. The receptors for smell are placed in the upper one third of the nasal cavity. This part it is lined by olfactory mucosa. The rest of the nasal cavity is lined by respiratory mucosa. The respiratory mucosa is highly vascular and warms the inspired air. The olfactory mucosa lines the upper one third of the nasal cavity, including the roof. It is formed by the cribriform plate of ethmoid bone and the medial and lateral wall up to the level of the superior concave. It is thin and less vascular than the respiratory mucosa. It contains receptors. Those cells are called as olfactory cells. For the descriptive purpose, the nose it is divides into two main parts, the external nose and the nasal cavity. The parts of external nose are root, tip, external nares, nasal septum, ala, and the dorsum of nose. The external nose has a skeletal framework that is partially formed by bony and partially by cartilaginous. The bones are nasal bones, which forms the bridge of nose and the frontal process of maxillae. The cartilaginous part are the superior and inferior nasal cartilage, the septal cartilage, and small alar cartilages. The skin over the external nose, which is supplied by external nasal, infratrochlear, and infraorbital nerves, and its lateral part formed by fibrofatty tissues. Next, the nasal cavity. The nasal cavity, which extends from the external nares or the nostrils to the posterior nasal aperture and is subdivided into right and left halves by the nasal septum. Each half has a roof, a floor, a medial and lateral walls. Each half of the nasal cavity, which measures about 5 centimeter in height, 5 to 7 centimeter in length, 1.5 centimeter in width, it is near the floor. The width near the roof, it is only 1 to 2 millimeter. The roof of the nasal cavity is about 7 centimeter long and 2 millimeter wide. It slopes downwards both in front and behind, and middle portion is horizontal. This part it is formed by the cribriform plate of ethmoid bone. The anterior slope it is formed by nasal part of frontal bone, nasal bone, and nasal cartilages. And the posterior slope it is formed by inferior surface of the body of sphenoid bone. The floor of the nasal cavity, which is about 5 centimeter long and 1.5 centimeter wide. It is formed by palatine process of maxilla and the horizontal plate of palatine bone. It is concave from side to side and it is slightly higher anteriorly than posteriorly. Next, we are going to learn about the nasal septum or the medial wall. The nasal septum, it is the median osseo-cartilaginous part which is seen between the two halves of nasal cavity. Each side it is covered by the mucous membrane and that forms the medial wall of both nasal cavities, which formed by both bony and cartilaginous parts. The bony part of the nasal septum it is formed by the vomer bone, the perpendicular plate of ethmoid bone. The margins of the perpendicular plate of ethmoid bone receives contributions from the nasal spine of the frontal bone in front, rostrum of sphenoid behind, the nasal crest of the nasal bone in front, palatine and maxillary bone below. The cartilaginous part is formed by the septal cartilage, the septal process of inferior nasal cartilage or alar cartilage. Then the cuticular part or lower end is formed by the fibrofatty tissue which is covered by the skin. The lower margin of the septum which is called as columella. The nasal septum is rarely strictly median. Its central part is usually deflected to one or other side. The deflection is produced by overgrowth of one or more of the constituent part. And the septum has four borders. They are superior, inferior, anterior and posterior borders. And it has the two surfaces. They are right and left surfaces. Next, arterial supply of nasal septum. The arteries which supplies to the nasal septum from antero-superior part, antero-inferior part, postero-superior part respectively. Antero-superior part it is supplied by anterior and posterior ethmoidal arteries. The antero-inferior part is supplied by the septal branch of superior labial branch of the facial artery. And the postero-superior part it is supplied by sphenopalatine artery. It is the main artery of the nasal septum. The antero-inferior part or the vestibule of the septum which contains anastomosis between all arterial branches. Example, the septal branch of the superior labial branch of the facial artery, sphenopalatine artery and anterior ethmoidal arteries. They forms a large capillary plexus. It is called as Kieselbach plexus. It is the common site of bleeding from the nose or epistaxis. It is commonly known as Little's area. The venous drainage of nasal septum. The venous drainage from the plexus which is more marked in the lower part of nasal septum or the Little's area. The plexus drains anteriorly into the facial vein and posteriorly through the sphenopalatine vein to the pterygoid venous plexus. The nerve supply of nasal septum. The general sensory nerves which arises from the trigeminal nerve. They are distributed to hold the nasal septum. The antero-superior part of the septum which is supplied by the internal nasal branch of the anterior ethmoidal nerves. And the posterior-inferior part which is supplied by nasopalatine branch of the pterygopalatine ganglion, which is the main nerve supply of the nasal septum. And the special sensory nerves or the olfactory nerves, which are confined to the superior part of the olfactory area, which transmits through the cribriform plate of ethmoid bone. The lymphatic drainage of nasal septum. From the anterior half, which is drains into the submandibular lymph nodes. From the posterior half, it is drains into retropharyngeal and deep cervical lymph nodes. Finally, the clinical anatomy. The common cold or rhinitis, it is the commonest infection of the nose. It is may be infective or allergic or both. It commonly occurs during the changes of seasons. Then paranasal sinuses may get affected from the nose, so it will affect the maxillary sinusitis. It is the commonest of such infections. The relations of the nose to the anterior cranial fossa through the cribriform plate of ethmoid bone and to the lacrimal apparatus through the nasolacrimal duct are important in the spread of infection. Infections of the nasal cavity may spread into the cranial cavity. Fractures of the cribriform plate of ethmoid bone with the tearing of the meninges may tear the olfactory nerve rootlets. In such case, CSF may drip from the nasal cavity. It is called as CSF rhinorrhea. The spinopalatine artery, it is the major artery for epistaxis. The little's area on the septum, which is a common site for bleeding from the nose or epistaxis. The pathological deviations of the nasal septum, it is often responsible for a repeated attack of common cold or allergic rhinitis or the sinusitis, etc. Deviations of the nasal septum can correct with the help of surgeries.